My name is Marcy Athey Graham, and I'm a DIS in Lincoln, Nebraska. I've been a DIS just over 14 years. There's a couple things I really enjoy about the work. The first thing probably is being able to meet folks where they're at, being able to spend time with someone and hearing their story, having the skill set to be able to build rapport with folks very quickly so that they feel comfortable to share information, sometimes very personal information. The second part I really enjoy is the investigative part. Being able to put pieces of a puzzle together to try and locate someone that we need to get in for testing and or treatment, interesting to me, and um, I really enjoy it. I have had different capacities in sexual health over the last 14 years, but I started as a DIS and I believe in this work. I think we offer something that really no one else does as far as sexual health. We're not a nurse, we're not a provider, we're not a case manager really. We're a little bit of everything, it feels like. And I do think it takes a really special skill set to be a really good DIS.
My name is MJ Grayboys, and I'm a DIS at the City of Evanston Health and Human Services Department. I love being a DIS. I love the way that DIS work starts with this opportunity to meaningfully intervene when a member of our community is experiencing illness. It's a privilege to have this opportunity to show up for them at the time of their diagnosis, to hold space for the full range of reactions they may be experiencing, provide a setting free of stigma where they can ask questions without the risk of judgment and receive answers based on evidence, and to connect them with the care that they need in that moment, whether it's for a culturally competent healthcare provider where they can seek treatment, or also for supportive housing, a warm meal, or benefits navigation. And I love that DIS work sees beyond this instance of illness, offering us an opportunity to work collaboratively to address the interconnected and systemic causes of disease in our community. I love that DIS work invites us to co-create a better future, together with clients, community partners, and colleagues. We're creating a future that is healthier and more just. I love witnessing members of my community accessing the health resources they need and witnessing not only their good health, but the good health of their partners, children, family members, neighbors, and friends.
My name is Emily Gregerson, and I've worked as a DIS for the last 6 years at the Tacoma-Pierce County Health Department in Washington State. These last 6 years working as a DIS have hands down been the most fulfilling and rewarding years of my almost 20 years in public health. It's incredibly hard for me to put into words what makes this job so unique. This position allows you to do so much more than just disease investigation. This job is one of the most challenging jobs I've ever worked, but I'm constantly humbled by the situations that people in my community are struggling with, but also working tirelessly to overcome. Being a DIS opens a door into the grittiest parts of people's lives in your community. Many people, including providers, are simply not willing to go to these places. Being a DIS has allowed me to connect with my community in a way that simply cannot be done any other way. Finding people to notify them about infectious disease diagnoses and exposures is hard. It often feels like trying to find needles in haystacks, an impossible task. I often hear, Emily, why do you try so hard to find these people? They obviously don't want to be found. But I truly believe with every fiber in my being that people deserve to be found. They deserve to be found and have their infection and situation explained to them in a way that they understand, in a way that's impactful to them. And that's the part that I love the most about being a DIS, finding people who consistently fall through the cracks and are not deemed worthy enough to find. Being a DIS gives me a sense of belonging in my community, and it helps me feel connected to good. It provides me with never-ending new perspectives into behaviors, but most of all, it keeps me humble. And every day I'm grateful I get to do this work.
Hello, my name is Yesenia Montalvo. Hi, I'm Lauren Buda. We are from Orange County, New York, Department of Health. We are DIS in the sexual health program. One of my favorite things about being a DIS is knowing that my work directly impacts the public and we're able to prevent the spread of infectious diseases. And for me, I love being able to support vulnerable populations, and it feels good knowing that I can support and advocate people that may not have access to care.